Do you think there are any markers for ME/CFS, and when will those when we might see those happen? Some specific ones.
Well, we have a device called a nanoneedle, and in that device, we always get a clear signal, a very clear signal. For every patient we've looked at, we've done over 50 now, and we don't have any false negatives on that.
Meaning all the healthy people don't have the signal.
Yeah.
Mm-hmm.
Right. So, and so we not. That's a very good test to distinguish patients from healthy people. So it tells you if you have a positive signal, it says you're not healthy, and then you have to figure out why. But was hoping that that got in place, it would at least tell the doctors that these patients are not healthy. Figure out what's wrong. We've been trying to do other patients with it, and it's been really difficult because they don't want to come in and get tested because there's nothing really, it's a pain and for them, and there's no benefit to them. And so we've struggled with that one, and we haven't really been able to do any other patients. We haven't figured out what a strategy. The problem is that we have to do the blood and process it quickly, and we can't freeze it, so we can't get blood samples from other people, and it has to be processed in exactly the right way. A lot of labs don't do it right, so that's something very useful. If we can figure out how to implement that, it may turn out to be a very good diagnostic. We have other biochemical signals that we think might be useful. We're going to explore those. The limiting factor of why we haven't done it yet is money. It takes somebody to actually do it, and it takes collecting a lot of samples, and someone has to then analyze the data. And we're saturated.
Mm-hmm.
In terms of everybody's got a lot of things that they're doing. One reason we don't publish very much, it takes a lot of time to put together a paper, and that means you're not doing experiments. So during this pandemic, a lot of people have sat down and done a lot of writing and organizing. So that will maybe get some publications out. But it's a problem. And we put up all of our data on a website that all scientists can access. So we're not hiding anything.